Hi everyone, welcome to GoLocal Live. I'm GoLocal News Editor Kate Nagel. Thanks for tuning in this Friday afternoon. I'd like to welcome on my guest, Kate Mason, Assistant Professor of Anthropology at Brown University, to talk about coronavirus from a public health perspective. So, Kate, thank you for joining us today.
Thank you for having me.
Would like to let you know a little bit about Kate. Wrote the book Infectious Change, Reinventing Chinese Public Health After an Epidemic. Now, this was specifically regarding the 2003 SARS epidemic. Reinventing Chinese Public Health. This goes back to, again, the early 2000s SARS epidemic. Have the Chinese learned anything? Did they learn anything from that particular one, do you think?
They learned a lot, but maybe not what some people would hope that they would have learned. So what they learned is that they do not want to ever be responsible again for an epidemic like SARS, which explains things if you know a little bit more about what happened after SARS. So after SARS, there was a huge influx of cash, both internationally and from the central Chinese government, to rehabilitate the public health system, which had really kind of fallen apart in the previous few decades following the end of the Mao period. So during the communist period, there's a lot of emphasis on public health, a lot of grassroots movements to improve local conditions, and they built a lot of local sanitation and vaccination stations and things like that. But over the few decades following the death of Mao in the 1970s, that system fell apart. And so when SARS happened, the big criticism, after the initial criticism of why did you cover this up at first, which I can get to in a moment, came the criticism of why is your public health system a mess? You don't have control over this situation. So in the intervening years, China put a huge amount of investment and just effort into rebuilding that public health system. And they rebuilt it in a very particular way. So it was built precisely to try to be organized around identifying and reporting new viruses like SARS. Okay? The problem with that is that I think people have an overinflated sense of just how powerful the central government is in the area of public health. So certainly they're showing their power now in terms of their ability to enact mass quarantines and shut down the whole country, basically, which is not something we could ever do here. However, they don't have a lot of control over the production and sharing of information at the local level. So China is so big, frankly, that it's not really possible for them to know what's happening all the time, everywhere, as much as people might think that they can do that, they can't. And so they very much rely on local health officials to perform the surveillance and then report it back up through this system they had developed precisely in response to SARS. The problem is there are a lot of disincentives on the local level for doing that.
Okay.
And so quite predictably, from my point of view, the local officials did not do that, and that's how things got sort of out of hand before they were able to clamp down on it.
Are you talking about SARS or are you talking about coronavirus?
I'm talking about coronavirus.
Okay.
Yeah, now I'm talking about coronavirus. So in terms of how those lessons were applied from SARS. But what was learned was this is a really big deal and we don't want the international community to hate us again. And so a lot of what is happening now traces directly back to that lesson learned from SARS of we better not take this seriously. We better do something. So once the central government did find out, they enacted these very aggressive controls that are now backfiring.
Okay, so you talk a little bit about that lesson. So when it actually gets to that central government, I mean, is that what we saw when they said we're coming in and building that hospital, so to speak, that everyone saw the pictures of building it in a week, 8 days?
Yeah.
But again, let's talk a little bit about the time frame. You know, you follow it closely. You know what happened with SARS in 2003. You know, is it really kind of stem from what happened in those preceding weeks leading up to it? Was there a lack of flow of information about what was happening in the very nascent stages of identifying this new coronavirus?
You mean for the virus right now? Yes. So right now, and this is going to answer your question, but right now the really big deal in China and the very recent news is the death of You may have heard the death of the whistleblower who had told his colleagues about what was happening early on. Now, the reason that he got in a lot of trouble for that is that it is illegal to report on novel viruses directly to the public. So it is actually a state secret. Finding out that there is a new virus is considered officially a state secret in China still. So what that means is that you are supposed to report it to your superior, who's then supposed to report it up. And then at the provincial or the central level, that's where they will decide whether to release that information to the public.
But he went public.
But he went public
and he
without.
got reprimanded.
Yes.
Okay.
He went public without following that procedure, and that is why he got in quite a bit of hot water with the authorities. Now, they had to back down because of popular opinion about this. But now that he has passed, I think it's going to be very interesting to see what happens in China because people are extremely angry and upset.
As you said, again, not very much information at the beginning stages. The whistleblower sort of, again, chided, reprimanded, very much officially so, and then just passed away. So as you said, a lot of outrage. But now this reaction from the Chinese government, again, as we saw, the building of the hospital within 8 days, and as you said, the major clampdown in cities that you said you just could not envision happening here in the U.S. Let's stick to China for a little bit about what we envision moving forward, and what you had learned from 2003 and what we could possibly expect here and now. I just want to start with the numbers. Do you think we're getting a true and accurate sense as to the numbers of both fatalities and infections in China itself?
No. I think it's pretty clear. Anyone who has followed China and public health will be quite suspicious of those numbers. My feeling is that it's very likely that the fatality rate is actually quite a bit lower than what is expected or what is being reported now rather, because it's harder to hide deaths than to hide mild cases. And it's not even so much about hiding necessarily as just the capacity to even count, right? So in Wuhan, anyone who is not in very, very dire straits is being turned away. So you're only really counting those very severe cases. So I think probably the true number of cases is a lot higher. The true number of deaths is probably somewhat higher, but I think that those two things are probably not proportionate to each other.
Okay, as you said, can't keep track of the cases of infections. Having studied SARS in 2003, here we are in the beginning of February. Every virus is unique. Every, the World Health Organization looking at it as an epidemic. What can we expect moving forward? Do you think they have control over it? I mean, is that even something that you can speculate on?
You mean China or the WHO?
Well, China for starters.
I think that China is losing control of the situation more broadly, which is very much the impression I'm getting both from friends and colleagues I have on the ground there, as well as my own perspective based on the work I've done in the past. I think that they probably are, through those really extreme measures, cutting down on the number of cases, but at what cost? Okay. They've literally put the whole country of 1.4 billion people on lockdown. People thousands of miles from the epicenter of this epidemic, where there are only a handful of cases, have not left their homes in weeks. They are worried, they are bored, they are frustrated, they are scared. And so what we're seeing is a kind of discontent that could rapidly spiral out of control. I don't think we're gonna see mass demonstrations, partly because no one wants to go outside or see other people. But I do think that the government is losing control of the situation, and I think they are very worried.
And so, you study it from a public health perspective, studying how governments, specifically China, respond to these episodes. But, let's talk a little bit about the fear factor of, oh my God, if I go out, I'm going to possibly catch this new novel coronavirus. How much does the fear factor come into play? As you said, thousands of miles from the epicenter, people being told, not to go out, getting some sort of stir crazy. But in China itself, the reaction of when a new virus emerges, do you think people are armed with the information that they need to stay healthy, to not contract it, or is there any hysteria?
There's a lot of hysteria right now. There's a huge amount of hysteria in sort of compared with the actual threat. So yes, we don't want a new virus, and yes, there are some people dying, but the large majority of those are the people who typically suffer in outbreaks of respiratory viruses, including the flu. So elderly people who have poor health to begin with. So that's not to discount that it's a tragedy anytime someone dies, but again, we're talking about a country of 1.4 billion people. When 600 people die, it is not a total catastrophe, but everyone is feeling that it is. And so the trouble is that people are very panicked, and there's a huge economic consequence of this. There's a huge psychological burden. I had a Chinese student crying in my office just a couple of days ago because she's so worried for her grandparents, who incidentally are stuck in an apartment and don't feel they can leave. So it's a very serious situation on a societal level, even though the virus itself, I think, is only responsible for a small proportion of the problem.
And let's talk a little bit going beyond China's borders. Obviously, what we've seen, here, the CDC reporting on those first cases of individuals who specifically had been traveling to China and then coming back. Again, having studied SARS in 2003, and that balance, sort of, if you will, and that plays into that time frame of when the information was made sort of public when. But, where things are at currently with, flights, with cruises, we're seeing obviously the spread stemming from people who have traveled specifically to China. But now New Jersey just had a cruise ship today that said that there were several individuals that they were investigating there. Let's start even with the flights. I mean, again, beyond this, if moving forward there's another new novel coronavirus, what's the balance? When do you say clamp down on flights, clamp down on travel, or that's overkill and you're going to really severely damage the economy? How do you balance public health with the economic interests of both the Chinese and internationally?
Yeah, I mean, look, this is a really tough decision that I'm glad I'm not making. That said, I do think the international community has not been responding the way I would hope, in that they have been instituting things like blanket travel bans, shutting down air travel. Russia tried to close, a huge proportion of its 2,600-mile border. Attempting to do things like that are unlikely to be very effective, and they have a huge impact economically and for people on the ground's livelihood, especially in China. So that's only worth it if you could imagine China doing the same to us and us thinking that that's reasonable and appropriate, which I think most people would not feel that way. As a point of comparison, in 2009, there was a flu pandemic, you may recall, of H1N1, that started in North America. And Chinese public health officials were actually quite upset that the United States, where the first big outbreak was in California, was not cutting themselves off from the world in the way that China now is trying to do with sort of international encouragement. That wouldn't occur to officials in the United States, and I think President Trump and pretty much everyone else, frankly, would be quite upset if such travel bans were instituted on us for a virus that had killed 600 people. So this is not Ebola. This is not the plague. So I think the reaction has to be proportionate, and right now I feel it's not.
And is it because it's a new novel coronavirus? Does it stem from, it's where it originates from? There's sort of, did it come from it? That did it come from this market? Why is it just because it's that new and sort of, we all see those movies, Epidemic and Outbreak. So why does it get that sort of attention when we talk to public health officials and flu kills more, exponentially yearly than a new novel coronavirus?
So I think it's a combination of things. I think one is anything new is scary, and we have been primed to think that. The global health community is genuinely afraid of a new respiratory virus that has the potential to kill on the scale of the 1918 to 1919 flu pandemic, which perhaps you've heard others talk about. That was a devastating worldwide pandemic that killed 2% of the world's population. So that was a very different scale than this. And I think that the concern from global health officials is always that they don't want that to happen, and they want to stop anything new that looks like that before it gets out of control. But there are other dimensions to this, sort of exemplified by some of the xenophobia that we're seeing in terms of people unwilling to go to Chinese restaurants, Chinese students being barred from entering places or barred from coming back to school, people looking suspiciously at anyone Asian looking who is not wearing a mask. Those kinds of things, I think, are rooted in a kind of orientalized fear of strange diseases brewing in dark parts of the world. And so there's a bit of a racist element to this that unfortunately tends to rear its head in these situations.
And here in the U.S., constantly getting updated by the CDC, of course, of the cases that they're monitoring, of the cases that they say are, they determine are the coronavirus. How would you say, because it has been fairly limited at this juncture, how would you say the CDC's reaction and handling of things? Does it very much mirror 2003 and SARS? Has the CDC here learned anything from previous, epidemics or other viruses like you've learned and written about? Where are we with here domestically in 2020?
Yeah, it's a good question that I'm not sure I can answer that well, as that's sort of a little outside of my area of expertise. But from what I can tell, I think that they too have learned to be much more cautious. So for example, during SARS, there were not quarantines of people returning from China for whom you did not have a reason to think they might have it. So yes, if you returned at the time and you had a cough and a fever, you would be isolated. Or if you were coming from having worked in a hospital, you might be isolated. But nothing of the scale we're seeing now, where anyone who's been to the entire country has to be isolated for 14 days. Again, I'm not an epidemiologist, so I don't want to say it's excessive from an epidemiological standpoint, but from where I sit, it feels excessive and feels like the CDC has learned some of the same lessons as China, not quite in the same way, but just in the sense of we really don't want to be too cautious. We'd rather be overly cautious and cause some small amount of harm than be responsible for an influx into this country.
And so, we talk about where things currently stand. It looks very much still focused in China. Again, some cases here, I believe a person-to-person case of someone who'd been there, but nothing on any sort of mass scale. If it reached a point, not with this or someplace in the future, I would imagine the U.S. would probably treat things a little differently than China would. Again, we don't have the same governmental structure and clamping down to that degree. But do you think we'd be prepared for something even more widespread, from just that societally perspective of telling folks they can't go out or additional quarantines? Do you think we're equipped domestically here for something in the future that could be potentially bigger?
Probably not. I think there's been a lot of preparation on the part of health systems and public health professionals to prepare exactly for that scenario. So there are preparedness professionals and trainers whose whole job it is to do tabletop exercises and try to prepare for exactly the scenario you're talking about. However, from a societal standpoint, there's a lot less tolerance for the kinds of restrictive measures that might, from a purely disease control perspective, be recommended, at least for a short period of time. I think we could never do anything on the scale that is happening in China. I think you'd be hard-pressed to find anyone who disagrees with me on that. I don't know that we would want to. I'm not particularly pleased about what's happening in China. Like I said, I think it's excessive, but I do think that we just don't have the kind of societal norms that allow for a response of that magnitude. And so I think there would be a lot of panic of a more public variety than what's happening in China, where it's mostly on social media, people complying but quietly panicking on their smartphone. I think that we'd see a lot more public panic and anger and refusal to comply if we tried to do something on that scale. So in terms of the control of the disease, no, I don't think we could. In terms of the capacity to treat cases, I think we're much better prepared than China was, because China's main focus was really on, let's stop this from happening. And they didn't think past, what about after it happens, and then what do we do? So the whole focus was outward. We don't want to be the source, so let's stop it. But they weren't thinking about, what do we do with our own citizens when it is spreading and we don't have that capacity in the hospitals? They are able to do things like build hospitals in 8 days, which we cannot do. So that is one thing. But the quality of care in those hospitals is quite questionable.
So, you talk about the book from 2003, the Infectious Change, Reinventing Chinese Public Health. So they had learned certain lessons and thought they were equipped. But here we are in 2020, so learned some things, but again, not that immediacy of what happens right away. Do you think they'll learn from this one moving forward?
I think they're going to learn something, something different than what they learned last time, for sure. I don't know what it is yet, though. I don't know what the lasting lesson will be, except perhaps that they cannot exercise the same control over information that they could in 2003.
Sure.
So one of the really big differences internally in China between the SARS outbreak and this outbreak is social media. So back during the SARS outbreak, I was there when it first started, and it was still a word of mouth kind of situation. So while certainly there were rumors going around and you had people telling each other things, it wasn't at the same magnitude that you have now. And I think what the Chinese government has been discovering in the last few days is they can censor, but they just can't censor fast enough or wide enough for the number of people who are bored and at home and have nothing better to do than to write things on social media.
Well, there's also been some, coverage in the press here of, is there any misinformation coming out? Aside from Dr. Li Wenliang, who again was reprimanded for putting stuff on the social media, that was true. Any concern he called it, and he was a whistleblower, and he passed away. Any concern for false information?
Oh, there's tons of false information going around. But because there hasn't been the same open conversation about fake news in China as there is here, and because there's an assumption in China that most things are fake news, people are quite aware that their news is being shaped and framed in a very particular way. And so they're very predisposed to trust anything not coming from the government a lot more than government information, even in instances when the government information might actually be more accurate. So the folks that I've talked to are very inclined to believe almost everything they're seeing, even when, to me, it looks like a very clear case of fake news. Things like, hallways lined with bodies, which some of those photos and videos have been kind of debunked as clearly having questionable origins. But people are very inclined to believe it because they're already quite paranoid about the government providing them with information with good reason, right? That information has been controlled for decades. And so it's a very different landscape over there in terms of what people see and believe on social media. And it is troubling from that perspective as well, because there's a ton of misinformation going around. But when the government says, don't believe rumors, everyone just thinks the government's just saying that, and I should probably believe it more.
So here we are, you're probably collecting your information. When are we going to see the next book about this episode? Have you asked Brown for a sabbatical yet to write this one? Because clearly there's going to be a lot of analysis in retrospect. When you wrote about the 2003 SARS epidemic, what year did the book come out?
The book didn't come out until about 4 years ago, so it took quite some time. I was there during the epidemic, but I was not yet an anthropologist as I am now. And so it took some processing, going back to school, doing a long follow-up project, and then it takes a long time to write and publish a book. So I'm not going to be publishing a book about this in the near future. That said, I am trying to get out there and put out my analysis, because I do think it's important for people to hear from someone who has some experience with the folks who are dealing with this situation over there. So I don't know about a book, but you will probably hear more from me on this in the future.
Well, I appreciate you taking the time to come from Brown, tell folks a little bit again about that public health perspective, especially as it pertains to the Chinese government, what we're hearing and seeing in the news, and what you learned from that 2003 SARS epidemic. But wow, really the role that social media plays in the way that information gets out. And we'll be continuing to follow this more. So Kate Mason at Brown University, I appreciate you taking the time to come in.
Thanks so much.
And thank you for watching us here on GoLocal Live. We'll be back next week here in studio in downtown Providence with more news, lifestyle, sports, and more. I'm GoLocal News Editor Kate Nagel.